Hi, everyone. It's Alex Savage from KTVU, Fox 2 News here in the San Francisco Bay Area. And during the coronavirus pandemic, with lockdowns all across the country, this whole situation has presented really a unique set of challenges for those who are recovering from addiction and trying to remain sober. Joining us now to talk more about these issues is Bo Mann, who's the CEO of Sober Grid, which is a mobile sober community. Bo, it's so good to have you on here. I really appreciate you taking the time.
My pleasure. Thank you so much for having me.
I want to get into the particulars of how exactly the online sober community works through the app that you have created. But let me start big picture, kind of looking at how folks are doing in the midst of the pandemic with the stay-at-home orders. How difficult is this time for those who are recovering from addiction?
Absolutely. It's a really challenging time for those that have substance use disorder. You see people with substance use disorder oftentimes have co-occurring disorders such as anxiety, depression, and other mental health issues. And with the anxiety and the depression and the isolation spiking, it impacts people with addiction. And so we're seeing a rise in overdose rates and relapse rates. Additionally, even if those co-occurring issues are not impacting someone's recovery, isolation alone has always been thought to be something that someone in recovery cannot afford to do with regularity. So, people not having access to their support community, maybe churches, recovery communities, support groups, things like that, really creates a set of negative circumstances for those that are trying to maintain sobriety.
Yeah, I can imagine. It kind of feels like you're out on an island a little bit when you normally have this whole support network of friends and family, and as you said, colleagues at work, or whether it's fellow congregants at church. But all of that has not been there for quite some time for folks. I want to ask you about during this time you have this mobile sober community, an online community of people who are maintaining sobriety, and the app that you have is called Sober Grid. What have you seen in terms of the jump in the number of users here in the midst of the pandemic?
We've seen a large increase in members that are joining the app. The app is free to download, and so a lot of members are joining around the world, including in the U.S. We've also have a telehealth service through the app, and we've seen an increase in subscriptions to the telehealth service, which is mental health and recovery coaches. And so both for the free app and for the telehealth service, we've seen a substantial increase. I think the telehealth subscription increase was over 46% increase.
And along with that, there's a subscription aspect to this, and that is that. Well, no, the telehealth services, I beg your pardon, that is subscription, but the free component to the app, that is these virtual AA meetings that anyone could take part in?
So yes, so it's a community of we have over 250,000 registered members around the world in over 170 countries. And and that's for the free app. And in there, we do have 12-step meetings such as AA. We have non-12-step meetings, Celebrate Recovery and Smart Recovery, and Dharma. And we also have meditation practices where people meet virtually. But the core of the app, if you think of it like a social network like Facebook or Instagram, but bringing people together so that peers can support themselves, lay peer support, and offer each other encouragement and advice, and be able to reach out and help each other when they're in need.
Yeah, creating that sense of community, having someone to be able to lean on, even if it's in this new virtual setting that we're all getting used to. I was reading too that your app has something called the Burning Desire button. Explain exactly how that works.
Absolutely. It's a bit of an SOS call. So if you're in the app and you're having a difficult time, you can press the burning desire button and it will alert others in the community nearby you, hey, Johnny X is having a difficult time, and and others in the community will reach out to you and offer you support because the apps notify them that you're having a difficult time.
Wow. Um, are traditional addiction recovery services? I mean, obviously they're less accessible, but I mean, are a lot of the traditional programs, shifting to a virtual online sort of model, or is it more challenging for people to get those services at a time like this?
I think you're seeing across all medicine, including addiction medicine, I think you're seeing existing providers, whether that be a residential treatment program or therapists that specialize in substance use disorder. I think you're seeing providers wanting to adopt the use of telehealth. And so we've had a number of providers reach out to us to see how we can augment their existing service. And I know I've spoken with some executives from different addiction providers who are looking to kind of launch their own telehealth component. I think they see the need in it. The need is something that if you were in telehealth, like I've been for a number of years, you were always saying, look, people in rural areas need access to support and care, and or people that don't have access to transportation or have childcare and different other barriers that you have. And COVID-19 really made it abundantly clear all of those things, and a new reason why it's really important to offer a telehealth component, because a lot of people have always needed the virtual care component.
Yeah, right. Yeah, I mean, that's what it sounds like. And I've talked with other folks in the medical community saying, look, pandemic or no pandemic, in the future, it seems like there is going to be a real shift toward more telemedicine, right? That's kind of
Yeah,
where we're going.
absolutely. I mean, one of the advantages, I mean, COVID has been a terrible thing, but sometimes out of the bad things that happen, there's good results that can end up happening. And I think what we're seeing is the advancement of reimbursement from insurance. And we're also seeing some of the laws were relaxed due to COVID. And that included for people that for addiction medicine via telehealth. And that was something that was pretty restricted. And so now opening that up, I think there's more hope that more people with addiction can access care virtually.
I don't have to tell you. I mean, this has just been a really difficult, challenging time the last couple of months for our country. I mean, we started with the coronavirus pandemic. That led obviously to an economic collapse that has impacted so many people. And now we have a country that's dealing with civil unrest in cities across the country. I'm curious your thoughts about how, crisis on top of crisis on top of crisis, how much that weighs on people who are trying to remain sober.
Absolutely. I mean, I think part of the unrest is, could be, one small component of it, built up sort of anger and people may not be, they may have been impacted by months of being quarantined. And the same goes for people with substance use disorder and other mental health issues, is that it's been stressful, it's been full of anxiety, and now to see the unrest unfolding around the country, I think it causes more fear, more concern, more anxiety, and I think it's going to continue to be challenging for people with substance use disorders. And make no mistake, the opioid epidemic, unfortunately, has not gone anywhere. Mm-hmm. In fact, by some of the things that I've read, we may see an increase of substance use by individuals, even if they don't necessarily have addiction. You'll see an increase because of the factors, the mental health impacts from being quarantined. I was reading that through different sources, and that was before you had the unrest throughout the country. So I can imagine that will only be greater now.
Are you optimistic at all? Now we are seeing states beginning to shift into various phases of reopening, trying to get back to some sense of a normal life. How much optimism do you have for the folks that you work with on a daily basis, and the folks who seek help through your mobile community? Are you optimistic that with the beginning of stages of reopening happening, that it's going to be easier on them? There is some sense of hope that we're shifting into starting to get things reopened once again. Does that make you more optimistic for the clients you work with, the people who are recovering, that they can get back to a better place?
I'm certainly optimistic. I think at first there may be as much, if not even a slight spike in fear by reintegrating and opening back up, fear of contracting COVID. But I think after that initial fear wears off, by people having, greater access to supports in person, I'm very positive that the reopening of the states will help the people that have substance use disorders.
When you step back and look at it here, and you have so many more people who are logging on, signing up, using your telehealth services, and being a part of your online sober community, how do you have any sense? What do you think in terms of the number of people you may have helped to avoid relapse during this time?
Geez, it's tough. I know that we've helped hundreds of thousands of people around the world. Specifically over the last couple of months, I would say that we've had some type of positive impact in at least 20,000 people's lives. Whether or not that was as far as looking at the relapse rates, that's something we've been doing, and we're actually doing a trial with Perelman School of Medicine out of UPenn, because the National Institutes of Health had backed us, and we developed artificial intelligence that can predict if an individual is approaching a higher risk of relapse, so that then we can intervene. We haven't studied the relapse rates over the last couple of months because we're busy working on the trial with the AI, but it's something that I will look into to get a more granular number and kind of pinpoint how many of those 20,000 people plus people that we've helped over the last couple of months would have been most likely to relapse if we had not been there for them.
Yeah, obviously you need some time to kind of analyze what's been going on the past few months. That certainly makes sense. All right. Well, as we wrap up here, I just will remind folks that the app is called Sober Grid. It's a mobile sober community, telehealth services for those in recovery, one-on-one recovery coaching, and a lot of other services as well. Folks can find it in the App Store, I guess.
Yes, it's free in the
free in the app, free to download.
Yes, it's free to download in both the Apple and the Android app stores.
Okay, great. And if people want to, and the subscription aspect of it, how much does that cost?
That's $39.99 per month for unlimited recovery and mental health coaching.
All right. Wonderful. Well, I really, it's hard to imagine that a community like this online is not helping people during this really difficult time. So really appreciate the work you guys are doing. Hope folks, if they need help or they know someone who needs help, that they check you guys out. Bo Mann, the CEO of Sober Grid, really appreciate you taking the time. It is such an important issue, especially right now, and thank you for giving us your insight on the topic. I will let everybody know that we have more information that's up at our website. That's coronavirusnow.com. I'm Alex Savage from KTVU, Fox 2 News in the San Francisco Bay Area. I'll talk to you next time.